feel that masks protect us.
Yeah, I've read the study of the, I forget the name of the battleship. Like, there's 3 studies that I've read, you know, the whole thing.
Studies that they've allowed people to actually access. What about the studies, the randomized studies that say that masks actually don't protect us?
We were talking about masks. But yeah, the vaccine, I mean, that's even, can I see the studies? I mean, I haven't read the ones that show it's ineffective.
Because they don't show, they're not allowing those things. The censoring that is happening right now, they're not allowing that.
So there's police over there. These people are speaking out against vaccines. Why aren't they being arrested?
Why not? Why would they?
Well, because you said they're censoring.
Oh, but you still have, currently there's still some form of freedom of speech. You can. But I'm talking about on big tech medias like Facebook or Twitter, wherever that, you know, you have to go independent. They're not allowing those things to be shown. Or if you talk, you can't talk about a doctor who doesn't believe that this injection should be given. Doesn't have the same platform as doctors who are being told.
Well, so what is a doctor's job? A medical doctor, what is their job?
Their job is to give informed consent, right? So to discuss with their patients, tell them, give them this is what this is for, give them what the alternatives can be, which they completely disregarded, and then give the patient their right to choose without coercion or without.
But when a doctor makes a recommendation, where does that recommendation come? Should it come from their own research?
They should definitely be doing their own research. Yes. How can a doctor in good faith recommend something that they haven't researched themselves?
Well, because a doctor is not a scientific researcher. They're two different.
Yes, but if you are, so they should blindly just.
Oh no, they should read the experimental reports. They should look at the data. But I hear a lot of anti-vax doctors saying, I'm not going to give the vaccines because out of all the patients I gave, here are a few that I know is getting sick.
Yeah.
That's not research. That's not
first-hand research.
Those are
first-hand research.
So
if I'm a doctor and I'm treating, 10 patients that have come in after receiving any of the injections, and all of them have come in right after or immediately after with effects from this, life-changing effects from this.
Yeah, but
that is hands-on knowledge.
Are you an actual nurse?
Yes.
So you've read, when you were in nursing school, you've read scientific papers, yeah.
They read, we read books half a day about what they wanted us to read. It was up to me to go out and do my own research on what exactly is in.
But I'm sure you've read an experimental report in a journal like the American Medical Association or things like that. And you see that when they conduct a proper medical experiment, they have a control group and they have the intervention group. And they give a placebo.
Yeah, can you tell me, so in these childhood, let's talk about childhood vaccinations.
But
has there ever been a control group and a non-control group? Have we ever tested vaccinated children against non-vaccinated children?
For the COVID vaccine.
I'm talking about just
yes. So for the MMR vaccine.
Have we ever tested children against unvaccinated children?
Yes. Yeah. I'll show you the study right now.
I'm not here to argue. Like, I'm really not here to argue.
Yeah, but it sounds like you need to be educated. Like you're saying there's, but you just said there's no such study, and
There's no study on vaccinated against non-vaccinated and how they turn out in the future.
Yeah, so
long-term studies on that.
So a placebo-controlled study. Would you like to see one?
And they receive emails and they come on our Zoom calls every
You can actually, instead of right now, because I don't have time right now, but you can actually email us at this.
But there's a lot of
So if you were to see such a study, a placebo-controlled, meaning they compared an unvaccinated sample to a vaccinated sample, would you change your mind on this?
It is, but it's happening.
Would any amount of evidence change your mind on this?
What would the evidence be?
Well, such a rigorous study.
I would have to review the study, look at it, but I know what's in these vaccinations, and they have never done a study on children who received the vaccines and how they have gone compared to children who have not. That study has not been done.
Andrew Wakefield did such a study, didn't he?
He did.
And when they tried to reproduce the study using his same methods, they were never able to reproduce the results. And also, while he was doing the study, he was serving as a paid expert witness for anti-vaccine trials, which he didn't disclose in the studies. But I mean, I'm saying that because I mean he's a proven fraudster because he never, he didn't disclose this. It was clear he was doing it for money, but also they followed in his footsteps using the same procedures that he outlined in his experiments.
Which when you get into things about big pharma and talking about vaccinations are a hot topic in the sense that everyone has an opinion. Big pharma has the biggest gain from vaccinations, right?
Well, wouldn't they gain more if they didn't vaccinate people and more people had to go to the hospital and they had to give more medications?
Have you seen the studies of how the trends of when vaccinations were introduced and where they were introduced and exactly where on the scale they were, the rate of people getting low sickness? Have you seen those studies of where, right? So
yeah, the smallpox one.
Yeah, smallpox, polio. They were already.
It starts.
Already before they even introduced.
Right.
And then that just recently, I think it was just a year or two ago, they introduced a drop polio vaccination in Africa, where thousands of children were dying. Thousands.
I have heard that. Yeah.
Yes.
They were dying of polio.
Of polio.
Was it a live? It was a live virus vaccine. Yeah.
Well, most vaccines are.
The COVID-19 ones aren't though.
No, they're even worse. They're a code. Literally, you're planting a code into a synthetic code into your arm, and hoping that your body can reproduce, picks it up and reproduce a protein, which our bodies are not designed to produce. We're not made to build proteins on ourselves. So this study has never done that.
I'm sorry, what nursing school do you? We build protein all the time.
Not this protein.
The spike protein. I see. Well, I mean, you're right. It does work with our body's RNA. Like it doesn't go into the cell nucleus. It doesn't alter our DNA.
It doesn't alter our DNA, but we don't know what's happening to it. So who's to say? So they've done a study, right? They did an autopsy on someone who received those vaccinations and died, and they said when we do regular vaccinations,
I did see that.
the majority of it still stays in our deltoid muscle, right? Or whichever muscle you got it in. Less than 20% of the COVID injection stays there. The rest of it just disperses throughout your body, right? And it binds with the protein, it multiplies and multiplies. Well, we've never done this before, so we know how it's multiplying and multiplying, and it attaches to our ACE2 receptors. Well, we don't want protein just attaching willy-nilly to ACE2 receptors, right? We don't want that, because that's what causes when you are overtaken with spike proteins on your ACE2, which are in our respiratory system, our brain, our ovaries, testicles, our blood vessels, our capillary blood vessels. It creates chaos. Our bodies are not meant to have to reproduce multiples and multiples of spike proteins. So, I think we just need to look a little bit deeper into it, right? Like a lot of people think, they get these studies, but these studies are not even, they're not long-term studies. How do you know you've received both your injections? How do you know that in 5 years you're still going to be healthy?
Well, the antibody production rate falls off. It starts falling off as soon as you get the vaccine.
I'm talking not about antibodies. I couldn't care less about
the spike protein.
I'm talking about what the spike protein is going to do to you and to your body. What are the long-term studies on that?
Well, that's not the only spike protein in our body.
The spike protein the code, they didn't inject a spike protein, they injected a code to make this.
Yeah, well, actually, the AstraZeneca, which I got, does not do that, but I see your point.
So, what are the long-term studies on what that code is going to produce? And if it does produce?
I don't think long-term studies are necessary because the production,
you would never
well, so there's two.
medication.
The production of the proteins stops a few weeks after you get the vaccine. our bodies don't keep producing and producing the spike
How do
protein.
you know that?
Well, because
Where are the studies on that?
well, that's the how would that happen? I mean, if it's the
How do
vaccine.
we know it's not happening then? If we said that this, if they've done an autopsy on someone who's received both vaccinations and died, and they found spike proteins literally throughout his whole body, and he died 2 months from now, 2 months, I think he died 1 or 2 months later. Well, that just proves that it's not isolated to this one spot. It's multiplying and multiplying, like millions of spike proteins, and they are going throughout his whole body.
So why haven't we seen any of these effects in animals with faster life cycles?
Every time they come, do you think this is the first coronavirus vaccine that they've ever come out with?
No, they've been developing. 10 years.
Years. Even in I think they came up with a source in the 90s. They have died. All animals that they injected died.
Yeah, because they choose animals with faster life cycles than us. So they died of.
You don't think so? You think within 24 hours of dying, or within a week, that animal should have died after receiving?
No, not after 24 hours, but after. No, I've never heard this before. What's the? I will.
It doesn't matter how. It could even be a month. You're saying that otherwise known healthy animals.
Yeah.
So when they injected them then with a form of, so they gave them the vaccination, they injected them with the coronavirus, and they literally died. It just.
Yeah. Well, that would be troubling. Can I see?
How do we know that that's not going to happen when you guys are confronted with a natural coronavirus of any sort?
No, if what you're saying is true, then that's very troubling. But who is saying this?
Doctors, there are a lot of doctors, silenced doctors, right?
So how do you know?
Whenever they talk about it, because you have to go on our own, because we're nurses, we've met doctors that talk about it, but
I mean, do you mean medical researchers?
I'm talking about, there are some medical researchers, there are some doctors who study immunology and virology, who actually created, who actually worked in laboratories in Ontario, who created, that's what their job was. They are very pro-vaccine and they create vaccines.
Yeah, so what I'm wondering is so you're saying that there are these medical researchers who have done these tests and have observed every animal dying within weeks?
No, I'm talking about currently with this one. There have been studies done previously about the animals getting injected with this mRNA vaccine, right? Previously. I'm not talking about this one right now that's out. This for Pfizer, Moderna.
Yeah.
I'm not talking about this one. But I'm saying that we've never had a proper vaccine for coronavirus. So what's this one that's not even approved? Not even approved.
It's approved for emergency use, yeah.
It's not approved. It's authorized for emergency, not approved.
What's the difference? Like in these,
means that it's gone through the proper testing, right?
but like they're saying that these vaccines have gone through the 3 stages and they've tested on this.
Gone through the 5 stages. In order for a proper vaccine to be, it takes 7 to 10 days, like 7 to 10 years, in order for a vaccine to go through the proper courses of study and going through all the clinical trials, not just clinical trials on certain groups, all groups, right? So they would test it on pregnant women, children. They would go through, it takes 7 to 10 years before it's that phase, then it would be approved if it passed all that. These ones are not. They rush through on authorization, emergency authorization, and they are still in the trial phases of them, which they admit. They are still in the trial phases of them. But were you told that when you went and got your injection? Were you told that this is a not approved vaccination? It's still in the trial phases. You are part of a study. Were you told all that?
I was told that they were approved for emergency use.
But were you told that you're part of the study? That's not even due to.
Well, no, but that's a given because like when.
It's not a given. It's not.
Yeah,
not
so I know that they're continuously looking at data for like the MMR vaccine, for example.
Always, this injection is due to study until 2023. That's when it's due. So they're studying. So right now, everyone who's signed up for this injection and gotten it is technically under a study.
I understand that, but
people aren't being told that. So how can you give informed consent to a study?
But every time we get any vaccine, we're part of a study because there are always long-term.
No, you sign up for it though, right? So
No. What I mean is that, like the MMR vaccine, for example, 20 years after it was released, they released another report looking at the long-term effects of it. So that means that everyone who got the injection was part of a study because, like, they passively.
It prior to it, though. They've done a study before, and they got authorized. But yes, you still follow up. But I'm talking about, in order for it to be approved, you have to go through a series of studies. Then it gets approved. Then it goes, and then you still will follow data. Yes, definitely, because you want to see how well it works.
I knew that it. Like, I didn't bother asking.
You didn't ask, but it needs. No, it's not. It doesn't.
I hear it on the radio. I mean.
No, it's not on the radio. So you're saying, just let you know that get your vaccine. It's going through. It's still going through an experimental phase of it. So that's all being told to people right when you go and sign, right when you go and get the jab.
Well, yeah, they say it's approved for emergency use and full.
It's not approved. It's authorized for emergency use.
Yeah, and full approval is pending.
What?
Full approval is pending.
And when is it pending? When is full approval?
Well, you just told me 2023. I don't doubt that.
Yeah. So 2023 is when the study ends. They still have to do their finalization to see how it affected people, right?
Yeah.
How is it going to affect people? How's it going to affect people next year?
Well, like there could be some mysterious long-term multiplication. Like, has there ever been a case where people have been given a medication and then years later, only after 1 or 2 doses, and then years later, they begin getting harmed?
When you have a medication that's come out and then people have been getting sick from it, any kind of, Bell's palsy, Guillain-Barré syndrome, blood clots and all that stuff. 10 cases, that medication is yanked from the shop, right?
Oh,
yeah.
If that's true, that's.
So now.
So wait. Regardless of the number being administered, like I know chemotherapy kills far more than 10 people.
I'm not for chemotherapy either.
But if that was true, no one would ever get chemotherapy because that has a lot more deaths attributed to it than 10 people.
So we're not running a healthcare system. We're running a sick care system, right? Because there are other methods for cancer as well. You don't have to go the allopathic medicine route to get chemo. I would never get chemo if I was diagnosed with cancer.
I probably wouldn't get it either because it looks nasty. But I mean, if it was, I don't think I would get it for palliative care if they said like you have a 10% chance of surviving anyway. But I would get it like Steve Jobs. He could have survived easily if he had started chemotherapy sooner. But he fell for the. Well, because he had a pretty treatable cancer. Well, I mean, you ask a good question. How do you make these determinations? Like, who do you decide to trust? Like, the alternative medicine industry is a $34 billion a year industry, and you don't think they have people saying things just to make money also?
I don't.
And that's just in the U.S. I don't know what it is.
I'm not even talking about alternative medicine. I'm talking about just God-given things, like God-given plants. Plants that you can find in any forest that you go to, or any things that you don't have to pay for.
Right, but most people don't forage. They buy things. I mean, have you ever gone out in the forest and...
Yes.
Oh. Well, I don't know very many people who have.
Because people don't bother. Their go-to is
Okay, so when you go into the forest and you choose something for a treatment, how do you know what to choose?
Because we have, there has been, people have been using these for years, right?
Yeah,
These herbs.
but maybe they haven't been. Maybe they've been convincing themselves they were because of the placebo effect and confirmation bias.
Well, or maybe they just have, because if you think about it, I mean, our food is poisoned, right? Everything right now is poisoned, right? We're full of GMOs, full of, radiation, 5G, like everything is like poisoning us, right? Like everything.
Well, 5G is not poison. 5G can't even penetrate our skin.
Well, I'm not, we can go on forever. I'm just talking about when it comes
But I mean, the basic question is, how do you decide what is true and what is not?
Yeah, because I don't, well, for me personally, I don't, when everything for me, everything I've been taught about masking in school, masking is not to be done on an everyday basis. The general public cannot be masked because proper protocol is never in place. When I as a nurse am not allowed to ask questions, I'm not even allowed to ask questions, then that puts red flags in my head. And when all that is coming from one source, public health, government, science tables, which are producing no science on it, then my red flags go up. So I don't trust that.
What's an example of a question you are not allowed to ask?
We're not allowed to ask, well, show us the science on nurses fought in 2018, 2002 about when they wanted to push, in Ontario, push vaccinations, flu vaccines, or we had to wear masks during our 12-hour shifts. We fought for that, saying, no, there's no science that shows the science. We had doctors, including Bonnie Henry, come to on our behalf. And at that point, they said, no, you're right, there is no science base that mask protect us from a virus. So nurses won that. We won the right to choose that. We didn't want to get vaccinated, we didn't also have to wear a mask.
But that's a case where you were allowed to ask for the science.
At this time, when I asked, well, where's the science on this, right? It's a virus, no different than the flu, right? In the sense that it's a virus, same size, particles, and why now is a mask going to benefit us when it's never benefited us in the whole issue of healthcare? And no, we can't ask questions like that. We can't ask.
Hey, why is
Show us the science because there's a narrative being pushed, right? You never hear about do your own research. We're not allowed to answer anything on masking. We're not allowed to ask anything on vaccinations. We're not allowed to ask on social distancing. We've never been able to lock down, close businesses, children out of school.
So you're not allowed to ask for the experimental reports showing that the vaccines
are... We're not allowed to ask any questions of why we're doing things. Why are these decisions being made?
I think you should.
Yeah.
And the data is publicly available for anyone who wants to read it. I can't believe that you'd be punished for like going on Google Scholar and typing in like vaccine placebo-controlled testing.
We show other science. We say no. This is because science is not a set thing. The whole thing about science is that it's always changing, right? That's the thing with science.
Yeah.
So we come and we present. If I came to my employer and I presented something, saying, I've heard all this. It's kind of giving me questions about this. No, they dismiss this because it doesn't fit that narrative that's being actually pushed out.
But see, there's a lot of studies that. So, you know what the placebo effect is, right? And you know what confirmation bias is. So, isn't it necessary for an experiment to be trusted to control for these things, to make sure that these things are not affecting the people doing the experiments?
Yeah, but is it being done?
Yeah, so in a rigorous study, and I'm not talking about a peer-reviewed study because I don't really trust the peer-reviewed process either, but in a rigorous study where they split up different populations, and even the experimenters don't know which one is the placebo and which one is the real medication until after the experiment is done.
So who's getting the placebo in this study?
Well, it's random.
So there are people who are getting the injection.
No, not in the population deployment, but in the initial 3-phase testing.
Because we're still in the study phase.